Hello and good evening. It's 6 p.m. UK time, so therefore it is time for our live event tonight. And welcome everyone to thank you already for joining us today. And well, there is another interesting topic that we are going to discuss, and of course we have another top expert, so I'm very happy to have you with us, Dr. Yanira Ayom. Hello, and how are you feeling today?
Hello, Caroline. I'm fine, thank you. Hope you are fine too.
Yes, all good. I am very happy that you have been able to join us today as well. And you will be able to, of course, present our topic, but also you will be able to help a bit our patients with their questions. And before that, just let me remind everyone that we are gathering here every single day since the very 1st of April to support you as you have been waiting to be able to continue with your treatments. And we just wanted to make sure that you can still ask your questions to the top fertility experts. And of course, most of you are already able to go ahead with the treatment, but we are going to support you till the end of June with all those events, so that if anyone has any questions or would like to simply get to know some of the top fertility experts, we just want to give you that opportunity. And I also want to mention that Stronger Together events have been brought to you thanks to our ambassadors and partners. You can see all of them right here. As always, thanks for their support as well. And well, today another topic that I've mentioned, and it is cross-border donations, the EV experience. And our top expert is Dr. Yanira Ayom Montalengo, and she is the reproductive medicine specialist at EV Las Palmas. So we are connecting to the Canary Islands, so it's very, very nice to have you with us. And of course, we will start with like most common questions, okay, that we are received from the patients. But after this, remember that you will have a chance to ask your questions. So if you have any, go ahead and type those in, and Dr. Yanira will be happy to help you as well, I am sure. And of course, least but not last, I would like to mention that this is being recorded. So, of course, you will have a chance to rewatch it. It will be available on our website, myivfenses.com. Probably tomorrow we will be able to upload it. So, if you have any issues, I hope not, but if you do, remember this will be possible for you to watch again. And that is it from me. Okay, Dr. Yanira, are you ready to begin?
Yes, wherever you want.
Excellent. Thank you so much. So I guess we can start with the very first question on our topic, right?
Okay.
Excellent. Thank you so much. So the very first question that we have. So what do you think? Why do you think, sorry, Spain is so popular for cross-border reproductive care?
Okay, let me make a little introduction, Caroline, about
Yes, of course.
cross-border reproductive care, okay, which involves the movements of patients across outside the countries looking for reproductive treatment and services, okay? That's a phenomenon that has been increasing during the last 2 decades, probably because the legal diversity and free movements of people through different countries is a perfect background for this type of studies. Also, the delayed childbearing in many developed countries is a very important underlying factor for CBRC, cross-border reproductive care. We already know that approximately 5% of all European fertility care involves cross-border traveling, and egg donation is leading this type of treatment. If we talk about USA, it is around a 4%, and there surrogacy is one of the most popular treatment for cross-border. The reasons for this type of traveling is because the legal restrictions in the origin countries is the most popular one, but also shorter waiting times, better outcomes, greater privacy, and lower costs are another reasons for cross-border reproductive care. And Spain meets them all. We are a very active country in Europe in fertility treatment with a long experience. And in fact, in 2016, which are the last data from ESRE, the European Reproductive Society, 130,000 cycles were performed in Spain, ranking the top 5 in the world. So therefore, there is no strange that patients travel to Spain because of our experience in this type of treatment, the results, of course, and mostly because our reproductive law is one of the most open and safe in Europe. Treatments are possible for female couple, single women, older women. We also can perform preimplantational diagnosis for the embryos. And regarding to egg donation, donors' anonymity is a very important factor, and very short waiting times are the principal reasons. ESRE data have found that 50% of all the egg donation treatment performed in Europe are in Spain. So that's a lot. And from that amount of patients, nearly a 10%, a 10% of the treatment performed in Spain were in foreign patients. So as I have said, we have a lot of experience with foreign people, and most of them were egg donation. Talking about IVI, 30% of all our egg donation are in foreign patients. 80% of them came from France, Italy, Germany, UK, and Switzerland, probably because of the law in their countries. So I think these are the basic reasons for Spain to be so popular for this type of tourism.
All right, excellent. Thank you so much for answering the very first question. Next one that we have is, so which are the most important factors for success in egg donation program?
Well, in an egg donation program, there are different factors that have influence in success. We could divide them in patients, donors, and the lab. Okay, probably the most important one is the embryo quality, and normally it depends on the egg quality. So the donor's screening is essential. We have to be very selective with the donors, and also have to look for a balance between the donor safety and results, because having a good number of eggs is important for the final treatment results, which is having a healthy baby at home. Regarding to the lab, the technical equipment, such as those depending on the IVF lab, as well as embryologist experience, are very important because they are going to allow us to transfer in the embryo in blastocyst stage, which is a very good quality parameter and raises pregnancy rates. The cryopreservation program is also another quality parameter. Talking about the patients, they have an also important part in this success, in these results, because the sperm quality, if a couple is coming, affects the embryo quality, and the mother's characteristics or conditions can also rise or decrease the success. So if the patient or the recipient is overweight or has any endometrial or uterus pathologies or high blood pressure or thyroid problems, it will affect the results. So that's why it's very important for the recipient to be as healthy as she can.
All right, again, thank you so much for answering another question and providing all those details, of course, on that as well. Let's have a look at the next question. So, why has EV bet for 100% single embryo transfer?
I like this question very much because I'm very defender of single embryo transfer. That's a very important challenge that our group promoted in 2017 and achieved in 2018. 100% of blastocyst transfer and 100% of single embryo transfer. This is so talking about egg donation, okay? And we promoted that action because it's very important for us, the safety of our patients, but it is also very important to maintain the quality of our treatment and the success rate. And nowadays, the pregnancy rate doesn't differ more than a 5 or 7% per attempt, transferring one or two embryos. And the risk of a twin or a singleton pregnancy isn't as 5 or 7% more. It is much more, it's more than a 50% the risk in a twin pregnancy compared with a singleton one. In fact, in nature, the rate of twin naturally at home in a spontaneous mode is less than a 2%. So we try to look to do our treatments as natural as we can, maintaining the pregnancy rates. The risk involved for the mother are preeclampsia, which is high blood pressure produced by the pregnancy, diabetes, bleeding during all the pregnancy, placenta abnormalities, higher risk of cesarean section, and for the babies, the most important risk is prematurity, with all the consequences that is produced, but also low birth weight, abnormal presentation, congenital malformation, risk of miscarriage, and all those risks rises with maternal age. And nowadays, most of our patients are over 40, which is in itself a risk for all these complications. And that's why we think that we have to take care of our patients, but also and for their babies. And we offer them safety and efficient treatment with minimal side effects and complications. So that's why we have bet for this type of single embryo transfer. This is very important.
All right. Again, excellent. Thank you so much for explaining why single embryo transfer. Definitely something to remember. And well, thank you for that. And let's have a look, okay, at the next question. So, how do you coordinate the treatment with the local doctors in the UK?
Yes. In all our clinics, we have a specific international units with doctors, nurses, assistants who speak patients' language, which is very important when you are traveling abroad for this type of treatment. We have all kind of protocols and information for doctors abroad and patients. In some cases, there are local doctors who are used to collaborate with us, so it's easier. But if there weren't any, there is no problem because we will send them a treatment plan with all the scans required and also the prescription for the medication that they are going to use. We try to make it as easy as we can for our patient and for our colleagues, so they feel as comfortable as possible. Because we know that this type of treatment has a very important psychological effect or impact because of the objective and the way to achieve it. The objective, which is having a baby, and the way to achieve it, which implies having to travel to a foreign country with a different language, and sometimes we could think that they are not going to understand us or I'm not going to understand them. So as I've said before, Spain is a very popular destiny for egg donation, and we have very quality reproductive results. We follow all the European normative standards for the patient and for the donors. And in our clinics, we have a long experience with foreign patients. So you don't have to be worried about coming to Spain for any type of treatment because we are going to give you the most excellent medical assistance and care and also make the best techniques available to the patients.
And once again, thank you so much for explaining how it works. And now we will go for our last question when it comes to those most common ones. Of course, then we will go to your questions. So if you have any questions, now it is best time to start typing those in so that Dr. Yanira can help you out as well, of course. And the question is, which are the EV criteria for donor selection, and what about now with COVID-19?
I know you have treated this theme before with another webinar about donors and selection donor, but I think it's very interesting. We have plenty of donor in Spain because Spanish people are very supportive. We are the first country in the world in organs donation. We have a very large blood donors bank. So it isn't strange that we have plenty of ex-donors. Anonymity is a very important fact for this big amount of donors. To assure our patients and our donor safety, we follow all the European safety guidelines, and a national registry for gametes and embryo has been developed according to that. So all the donors have to fulfill our inclusion criteria. As we have many women who wants to be donors, we can be very selective with them. So the inclusion criteria are women with good physical and mental health or psychological health, under 35 years old, most of them are under 30, with regular menstrual cycles, no family history or hereditary chromosomal diseases, a normal karyotype, a normal body mass index. They have to have normal ovaries, no pathology in the ovaries such as polycystic ovaries or endometriosis, or having more than 2 previous miscarriage or another gynecological or medical disorders. They have to have a negative screening results for sexually transmitted diseases. And we also have a genetical test, a special one, which studies over 600 recessive diseases, which doesn't rise the pregnancy rate, but gives you the calm or the tranquility to that you are not going to have a baby with one of those recessive diseases, which are very severe and don't have any treatment. All the donors have to sign a written informed consent form, of course, and they are legally compensated. We treat it with respect because we need them, and they are, we make a safe ovarian stimulation and retrieval with a very low risk rate. They are all well explained processes. We make follows up, satisfaction surveys, which is very high, and we offer them genetic counseling and psychological support. That's about the donors. And talking about COVID-19, at the moment we are adapting to this new situation in all over the world. We had to stop all the treatment in April and in March, the middle of March. And now we have opened all the clinics and all the labs, following all the sanitary advices and guidelines that we know by the moment, in order to prevent disease expansion. Okay, we have taken all the preventive measures in our clinics. All the personnel have been tested for COVID-19, for coronavirus, and we try to protect, in order to protect our patients and our personnel. It seems that there is no risk of infection through all sites, but we test all donors with PCR tests just before the retrieval, just before getting into a theater. And all the samples of vitrified eggs obtained between January to March 2020 have been tested for coronavirus. Okay. Regarding to the patients traveling, we depend on the government's sanitary regulations for the borders opening. So at the moment, it is supposed that next week, in July, the borders are going to be open, so patients can start traveling to Spain with security and with all the medical measures to prevent it. So by the moment, we are not going to ask them to be tested for coronavirus, okay, just in case they have any contact or any symptom, then we will. But I think there is no reason to delay pregnancy. Okay, coronavirus doesn't affect the baby directly. Okay, maybe indirectly it could, because if you are pregnant uh, and get ill from coronavirus, depending on how it affects you, it could produce a prematurity delivery or something like that. But I think we wouldn't. I wouldn't recommend to delay pregnancy desire. So let's see. We don't know what is going to happen at this moment. We are waiting another wave of coronavirus in October, but we don't know. At the moment, we are working normally with all the new measures, and we are waiting for all the patients be able to come to Spain.
All right. Excellent. Thank you so much. And for now, at least it seems that everything will be possible and you will be able to treat patients from abroad ending at the end of June. Yes. So very, very soon as well.
Yeah, yeah,
Excellent.
I hope
That's
so.
definitely good news. Everyone is definitely waiting for that as well. So, yeah, hopefully this will stay. This will be exactly like you have said. Thank
Yes.
you so much for this, answering all those questions, most common ones, of course, because now it is time for your questions. So, as always, let me encourage you, if you have any questions that you would like to ask, go ahead and type those in. We do have a few already, and I believe we will be able to start. Dr. Yanira, are you ready for the questions from our
Yes, I'm ready, Caroline.
I am glad to
Let's
hear
go
this.
ahead.
Let's start with the very first one. It's regarding the egg donors. Okay, so is it easy to find a black donor? I am myself a black woman and would like to get a from from a black donor woman, but it looks like very difficult to get any eggs from black donors in France. 2 years minimum in a waiting list. Is it the same in Spain?
Uh, Marie Victoria. No, fortunately here is not the same. It's not very common, but we have black donors. Maybe if you are looking at a specific phenotypic, because not all the black people have the same characteristic, but there is no problem with that. There is no waiting list for black donors here in Spain. The most difficult ones are the Asiatic ones to find, but black donors, if you need it, you could find here in Spain without waiting list.
Mm-hmm. Okay, excellent. Thank you so much. So, because you have said, so Asian donors are really difficult to find, but for example, you do have them sometimes. Is it possible?
Yes, sometimes
Mm-hmm.
we have them. They are very precious one
Of course.
because,
Yeah,
but
not so many of
the
those.
donors are women who live here in Spain. So
Mm-hmm.
Asian people is not very used to donate.
Mm-hmm.
So although they live here, it's difficult to find them, but we have it. We have it.
Okay,
We
so
use it.
possibly there is like a waiting time for those, I guess. Yes,
Maybe
somebody.
for an Asian one, yes. A black one, no, at all.
Okay. Okay,
Mm.
excellent. Thank you for that because, well, patient already, Marie already has mentioned. That's a very good news. Thank you, Dr. Yanir. Definitely helpful. So thank you for your question, of course, indeed, as well.
Yes.
And let's have a look. Okay. Next question. What are the regulations for traveling to Spain and returning? Also, should we self isolate for 2 weeks when we return home?
Um, That's a difficult question, Millie. It depends on your country. I don't know if you write from Britain or from UK, or I don't know. Because
Yeah, if you
yes,
could
yeah,
let us know, of course, yes, in the chat section, we'll be more than
London,
happy to
yeah,
ask. Sorry, London. Yeah.
yeah. There is a debate about that because British government has said, okay, if you ask for 2 weeks isolation, I will ask for 2 weeks isolation too if you come from Spain. So I think we are not going at the moment. We are not going to ask for that if you're coming here for an egg donation treatment. But I don't know what's your country government's going to say if you come from Spain. Um, uh, It depends. It doesn't. I don't really know. I don't really know. You are going to be able to travel to Spain, and if everything go fine, you are going to be able to come back. And I think you shouldn't be isolated for 2 weeks. But that's depend on your government regulation. We are not going to ask for that here in Spain at the moment.
Okay. Thank you for the clarification, of course. Yeah. So I guess we still need to wait for that information. Yeah. Because of course, everyone is wondering if it's possible to go, but what happens if I want to come back? Yeah. Because of
Yeah,
course, that
yeah.
would be very, well, 2 weeks quarantine definitely doesn't sound good for sure. So thank you so much for this. Okay, we were talking about black donors. You have mentioned some Asian donors. So if you could have a look, I am of Indian ethnicity. Do you have Indian egg donors?
Another difficult phenotype too, but Indian are more open-minded, I think, and we don't have Indian ethnicity, but we have very dark, skinny, very dark, very similar as an Indian ethnicity donors. Okay, we have Indian donors, but there are a few. So, but we can compensate. I mean, with a very dark Spanish or half Indian donor. But it's another one difficult donor to find.
Mm-hmm. Okay, understood,
Mhm.
of course. Thank you so much. And any other than Indian donors as well that you might have like more availability?
Sorry, Caroline.
If you have any like other than India, perhaps Thai or other Asian donors that might have like you might have like perhaps let's say more availability of such donors
Uh,
stress
it's the same like the Asian one. I
in
mean,
general.
yes. So if they don't come here to donate,
Mm-hmm.
they could be living here, but probably they don't come here to have
Yeah.
an egg donation. It's difficult to find them.
Mm-hmm. All right.
But we have a very long egg donor bank. So if you go to any clinic in EV and they don't have the donor who matches with you, we can look for your donor in another EV clinic. So we can send the egg to your clinic and have the treatment performed. So
Exactly. And I guess this is actually this kind of good option that's EV clinics in Spain, especially. I'm not sure how many, but I believe there are a few of those. So it's still possible to, I understand they cooperate with each other. So let's say
yes,
at one clinic you don't have them, but you know that other EV, let's say some other place in Spain, they have it, and this is possible to simply transfer. Yes.
yes, because we
Great.
are the same company. I mean,
Mm-hmm.
we are different clinics in different cities in
Mm-hmm.
Spain, but we are all the same. So we work together. We have a common egg donors bank. So as I've told you, if you don't have a donor, I can ask him, I don't know, Barcelona, and tell them to send me
Mm-hmm.
the eggs to here. So there is
Yeah.
no problem. We have one of the largest
Exactly.
donors bank. So
Yeah, that's definitely convenient, yes, because of course you might choose a clinic in one specific city, but you are still open. You might actually get some donors from some other places. Yeah, so definitely,
yeah,
it's
that's
good.
a very great advantage to be the
Yes,
same company. So
exactly. That's
mm,
what I mean. Because of course, standards are always the same as well. Yes, when it comes to the lab, etc., the way of doing, let's say, the whole treatment as well.
yeah. Mm,
Exactly. Perfect.
mm.
Thank you so much for clarifying this as well. Okay, if you could take a look at the next question. So, how much is it for egg donation treatment in Spain?
Oh, that's. I'm sorry, but that's a question I cannot answer because we don't used to talk about money in the surgery. I mean,
Hmm.
We talk about all the medical issues, but all the economical issues are treated outside with
Of
the
course.
specific assistant for that. But if you look in our page, I think the prices are listed. Or if you want to send us an email, we will answer you.
All right.
Because
Excellent. Of course.
I can give you a price, but I'm not going to be sure. So I do prefer you ask directly to IV clinic, any IV clinic, and they will answer you directly
Hmm.
and
And
exactly.
also, remember, I will just send you a link if you would like to get in touch with and just receive, sorry, some more details on that. Yes, you can use this link. There's an option to ask your question, and this will be forwarded to Dr. Yanira and her team. So, of course, they will be able to send you all the details. Yes, so there is no mistake. Yeah,
Yes, feel totally free to
of
ask
course.
us. There is no problem at all.
Excellent.
So, mm.
Thank you so much, of course, as I mentioned. Or if you wish, if you want to share any of your email address, yes, Dr. Yarnier, you can still do that in the chat section if you, of
Yes,
course,
I can
email.
now or later at the.
You can do it now or later, up to you,
Okay,
of course. Yeah,
I'm going to write it down
sure.
so you can ask
So
me
if
directly.
exactly, exactly. So if anyone would like to get some more details on those prices, etc., it will be possible. Yeah,
Okay, there it is.
excellent. Thank you so much, and of course, everyone can see it in the chat section now. All right, and now let's have a look. Okay, we do have another question, so here it is. I know it has been covered in another webinar, but is it anonymous when we use an egg donation? I know it is not anonymous in France or UK, so is this the case in Spain?
Uh, yes, here in Spain it's totally anonymous. So you are not going to know just a few details about the donors, the age, the physical characteristic, and the blood group. You're not going to be able to know anything more about the donors, and of course, she's not going to be able to know where are the eggs going to go. So here it is totally anonymous donation, but the moment, and I think it's going to be like this for a long time. Mm.
All right, thank you so much again for the clarification. So anonymous donation it is in Spain, of course, just to clarify to everyone. Okay, and let's have a look at the next question. So does the transfer have to happen at a particular time of the woman's cycle, or can we travel anytime?
uh, you have to travel. Uh, you cannot travel at any time, Millie, because the embryo transfer have to be when it has to be. I mean, your uterus has to be prepared and synchronized with the embryo for the embryo transfer. If I transfer the embryo at any time, they are not going to be synchronized, so you're not going to get pregnant. So we have to prepare your uterus before coming for the embryo transfer. But you can do all that preparation at home in your country and just come for the embryo transfer. Okay, we will give you all the medication you are going to use. When do you need to have the scans done? So we can adapt, for example, to your travel timetable. I mean, I have holidays in August. I want to be in Spain. I've had from this day to that day. So according to your period, and we will regulate your period. We will adapt to your times. But yes, it has to happen in a program or exact time. It cannot be whatever we want.
All right, excellent. Again, thank you so much for your question and, of course, for your answer to that. And in the meantime, I will show you that, of course, the patients that have asked questions would like to thank you for your assistance. Okay, thanks.
You're
And
welcome.
okay, perfect. Thank you for the clarification. Indeed, it was, of course, in regards to anonymous donation. And actually, there is another question in regards to anonymous, okay, donation.
Yeah.
Let's have a look. So can we know the age of the donor? So perhaps you can tell us what kind of information the
Yes.
recipient will get.
Yes, Katie. Sorry, I didn't inform about that. Yes, you are going to know the age the donor's age, because it is important to calculate the risk of Down syndrome, okay, which depends not in your age, but in the X age. So you're going to know the age, the donor's age, and the donor's blood group, and the physical characteristics if you want. That is what you are going to know. Okay, but the age is very important to know when you get pregnant and start controlling your pregnancy, because the risk of miscarriage or the Down syndrome, especially risk, depends on the X age. So you're going to know that. Sorry, I didn't say it before.
It is okay, of course. Thank you so much now for the clarification in such case. Okay. And next question is also ready. Is frozen sperm acceptable or is fresh sperm sample better?
That depends on the sperm quality. I mean, with foreign patients, we normally use frozen sperm because it's easier for organization. You will have to come to Spain one time for the first meeting, for explaining you, or just for leaving the sperm, and the second time for the embryo transfer. So if the sperm has quality enough, uh, we can use, there's no difference. We can use frozen one. If it's very, very bad sample of sperm, then we will recommend you to come to Spain for a fresh sperm sample. Okay, when we use donor sperm, it is frozen, so there is no difference between frozen or fresh if it has quality. But it is a border or a very bad sperm, then we will ask for a fresh sample, and in that case you should be here a week, more or less, for giving the sperm, and five days later the embryo transfer.
All right, excellent. Again, thank you so much for your question and your answer to that and explanation, of course. Okay, it's regarding the donor. Okay, once more, can we know the religion of the donor?
I'm sorry, but we don't ask about religion to our donors. So if it is important for you, of course, we can ask and tell you. Okay, but religion isn't hereditary or genetic issue, so it's not important for getting pregnant. I I understand maybe that because of your religion it is important too, but normally we don't ask our donors what religion do they follow. But if you are interested, if you want to know that detail, we're able to ask the donor. We have contact with them, so we can ask them.
Okay. All right. Thank you again for that question and, of course, that explanation. Yeah, excellent. Next question is also ready. So just give me a second. Yes. How long does preparation take?
Well, once you decide to start from your counting from your period, if you have periods, it takes around 2 months to be everything done. So if you have your period now in June, the embryo transfer could be at the end of August, more or less. Okay, it depends on your period date. So because we have to prepare your line, your uterus, in a not natural way, because that allows us to play with the dates. So it takes around 2 months to have all the treatment finished.
All right. Again, thank you so much. So approximately, you need to remember that it may take approximately like 2 months.
Yeah.
All right. Excellent. Thank you so much. And of course, next question is also ready right here. So, what cycle day is better to transfer? I have transferred on cycle day 26 and cycle day 21, and also taking estrogen and progesterone for frozen embryo transfer.
Uh, the day the, the day better for bit transfer depends on what type of endometrial preparation are you doing. If you do it in a natural cycle, okay, it has to be done a week after the ovulation. But if you are doing in a not natural cycle, like the one you have done with estrogen and progesterone, we can do it whenever we want. I mean, once your line is ready, you start with the progesterone, which is the hormone that changes your line, your endometrium, to be receptive for the embryo, and then we have to count from normally if it's a blastocyst, it's 5 days of progesterone to be ready to be transferred. So there is not a better day to be transferred. It depends on the way you prepare the your uterus. So
All right, again, thank you so much for explaining this to, and of course, there is a thank you from the patient right here for you as well. Okay, excellent. Well, there is another question. There are a few, in fact, so let's get to the next one. Is it recommended to have the same blood group of the donor? Personally, I am okay to have any blood group, but what do you recommend?
okay, I'm surprised with all the questions. The same blood group is just a question of you don't have to give any explanation if the baby, if your say if the baby comes from an egg donation or not. I mean, it doesn't matter if you are A positive and I put a baby who is B positive. Okay, and it's not going to change your pregnancy rate. But if the child, when he or she grows up, asks you, "Mommy, what blood group are you? Daddy, what blood group are you?" I'm A positive. I'm B positive. Why I am I don't know, um, B negative or something like that. And if you don't want to explain that it comes from a donor, you don't have to. So if you don't care the blood group, it doesn't matter. It's you will have more donors options, but we try to have a complementary blood group, a compatible blood group with you and your partner or with you. Okay, just in case you are negative, we try to look for a negative donor because if you get pregnant and the baby is positive for next pregnancies, if the next pregnancies are positive, you could have problems for the baby. Okay, so that's the only advice we with regarding to the blood group. But if you don't care, there is no problem. Okay, but we try to make or to look for a donor as much similar to you, and that includes your blood group.
And once again, thank you so much for explaining how it works, of course. And well, there are more questions coming up, of course. So let's have a look at the next one. Do you always do a 5-day transfer, or are there cases where you do an earlier transfer?
With egg donation, Katie, we do it at day 5 transfer. Why? Because what I told during my talking, that's the best way to select the embryo, because one embryo can be perfectly morphologically okay when we look at it at the microscope. The embryologists look at them, and on day 5 they can be stopped. And if it is stopped in the incubator, they would have stopped inside your uterus. So nowadays, transferring embryos in day 3, especially when it's an egg donation, it doesn't have many sense. You're not going to gain anything. Okay, if you want to get the higher choice and the opportunity, it's better to be transferred on day 5.
All right, of course. Thank you so much once more for explaining this again. And to the previous question, of course, there was a thank you. Okay, understood. Thank you very much. That was for the previous one, but just wanted to show you. And next question is also ready. I drink a lot of coffee. I am male. Would drinking lots of coffee negatively affect sperm?
Um, uh, Sperm is affected by a lot of different factors. No, coffee or caffeine affects the sperm quality, but it depends in every person. It's like smoking. Smoking it's affect the sperm motility, but there are patients who smokes a lot and have a perfect sperm. So um, the best way to know is having a sperm test done, and you will see and try to reduce coffee. Coffee is not a healthy drink to be drinking all day in male or female. But it isn't the most important factor which affects the sperm quality. The alcohol or the tobacco, especially, affects much more. So the only way to know is having a sperm test.
Yes, exactly. Thank you so much again for your question and of course for your explanation to that. Okay, next question also ready, so let's get to it. Do you accept blood screening tests from the UK that have been done within a year of starting treatment with the clinic in Spain? Would you accept recent rubella AMH tests done in the UK, and would bringing previous IVF egg donation notes from previous clinic be a help?
Yes, of course, we accept the blood screen test if they are less than a year. Okay, because the Spanish law tell us that we have to have all those tests done within a year. Okay, so if you have done it in another clinic or in UK or whatever, yes, we can use it. We can accept it. Okay.
Excellent. Thank you so much once again for that clarification. And for now, at least, it looks like it is our last question, so we will be slowly finishing. However, if you have any questions left, go ahead and type those in the chat section. This will be like a final a call for those questions. And of course, there's a thank you for you from the previous patient. And next question is also ready here. Would you do further tests after 2 failed egg donations?
Amy, I need to know what you mean with 2 failed egg donations. 2 failed embryo transfer from the same donation, or 2 different egg donations failed? Because it's different.
Yeah, I think someone is typing, so let's give it a minute. No, different egg donation. Okay.
Okay. Yes, we should look for what's happening, because maybe something is happening to failed egg donations, to failed embryo transfer, or I don't know how many embryo transfer from those egg donation, because it depends on the number of embryos you have been transferred and the quality. I should have more information to answer you this question. Maybe you can write me an email, and I will answer you personally, because I need more information. But after 2 failed egg donation, yes, I will do more tests in your endometrial receptivity. 5 day and she's quick. She's very
Indeed.
fast. 5 day and 3 day transfer, but only 2 transfer, because we have to know the sperm
Mhm.
quality, how was your uterus. Anyway, yes, if you come for another egg donation, I would ask you for some test, about blood coagulation, yes, maybe immunology if you haven't done it, and also receptive test in your line. So yeah, we could to each time, triple lining each time. Okay. Uh, the same answer. Yes, I would do some more tests.
Of course, and as you mentioned, yes, if you would like to get like more details, I'm sure you will also, Dr. Yanira, you would definitely need more details to provide like a thorough examination and of course explanation and advice, right? So of
Yes,
course,
yeah, no
uh,
problem at all.
me, if you wish, just there is a link, but there is also an email address to Dr. Yanira, and I'm sure she'll be more than happy to help you out some more.
Yes, sure, sure.
Thanks. Thank you so much. And there's a thank you from Amy as well. Okay, and for now, again, it looks like it is our last question. So let's have a look at it. Can you recommend any particular supplements for a female of 45?
For getting pregnant naturally, I guess. Um, it's difficult, Mondef, because there is any particular supplements that has demonstrated that function for a 45.
Egg donation, but of course,
For egg donation.
yes.
No, just folic, the vitamins for the pregnancy, folic acid and vitamin D, vitamin B, the vitamin complex that all the pregnancy women use. Do you need the trademark or something like that?
All right, thank you. Someone is typing, so perhaps we can wait a minute. In the meantime, one more question has popped up just here, so just let's have a look. Or perhaps let's go to the next question. If I have the answer, I will simply go back to the previous one, okay?
Okay.
Let's have a, yeah, okay, follow-up question actually. So is DHEA or coenzyme Q10 good?
Yes, it is. But that's better when you are going to use your own eggs. Okay, that's it's being studied, okay, about that supplements, and they seem to be useful for getting better eggs quality when you are using your own eggs. But for using egg donation, they are not really necessary, but they are good too. Okay, as healthy as you are, better results you're going to have. And there are vitamins, there are supplements that can help you to be more healthier, but they are more specific for improving the eggs quality when you're going to use your own eggs.
All right, excellent. Again, thank you so much for the clarification. And of course, there's a thank you from the patient. And when we are talking about supplements, have a look, okay? I am taking vitamin C supplement throughout IVF while taking folic acid and vitamin D. Is vitamin C okay? I heard it helps with progesterone levels.
Pamela, yes, it can help. Okay, all the vitamins can help because you have to be with all your mineral levels more regulated as you can. So vitamin D and vitamin C or vitamin B12 can help you to for the pregnancy. Okay, the folic acid is for the development of the central nervous system of the baby and to prevent bifidus. I don't know the name. Bifidus. Sorry, I know the exactly name in English. But vitamin C don't really rise progesterone. Spina bifida, yes, thank you, Pamela. Uh, then really, it isn't demonstrated that rises progesterone levels, but you have to be as many equilibrated as you can in all your body. So it doesn't hurt. It can help, take it. Yes, spina bifida.
Yes, excellent. Thank you so much for that clarification as well, of course. Excellent. Thank you. And of course, thank you from Pamela as well. Okay, and let's have a look. I believe there is another question. So, yeah, sorry, here it is. What do you think is the best, fresh or frozen eggs? Which do you please prefer?
Well, Sarah, in my experience, or well, it is already demonstrated that there is no difference between fresh or frozen eggs. Okay, I would prefer fresh if I have a testicle biopsy, for example, which is a very bad sperm sample. So I prefer the egg to be fresh. But if it's not that, if it isn't that case, it doesn't matter if it's fresh or frozen. They have the same blastocyst reaching rates. They have the same pregnancy rates. The only difference between fresh or frozen is if, for example, if in fresh cycle or the fresh retrieval, you get 12 eggs, you're going to have 12 mature eggs to be fertilized. But if, for example, you have 12 frozen eggs, maybe sometimes when you thaw them, not all of them are going to survive. So maybe you have 10. But between 10 to 12, there is no difference. So only with testicle biopsy is the only case I would prefer fresh one. The other one doesn't matter.
And once more, thank you so much for your question and again for your explanation to that. And there is another thank you from the patient right here. Thank you so much. And someone is typing, so I just want to, yeah, there is another question. Let me have a look right here. My donor X is blood type 0 plus, mine is 0 RHD plus. Is this okay?
Yes, it is, Pamela. There is no problem at all with that. You can be calm.
All right, excellent. And there is a thank you as well from the patient. And we have mentioned frozen eggs and fresh eggs, and with frozen sperm, is it better fresh or frozen sperm then, right? I guess.
Then the same answer. I mean, if the sperm is normal, it doesn't matter using fresh or frozen eggs. So doesn't matter. It's only when it's a frozen biopsy sperm when I prefer personally to use fresh eggs. But if we have a normal sperm, it doesn't differ between fresh or frozen eggs.
Okay. Again, thanks so much for the clarification. Someone is typing, so I just want to make sure that we have answered all the questions, but one more question has shown right here. So does taking dexamethasone help with implantation?
Uh, that question of dexamethasone has became popular because now immunology is a very studied field, a very increasing field in fertility. Okay, so some patients with repeated implantation failure maybe have an underlying immunology problem which can be treated with dexamethasone. But taking it in because of it helped for the implantation, I wouldn't. I would take if I have been studied and I have an indication, but not because it helps with the implantation. It helps when you have an immunology problem. If you don't have any immunology problem, it's not going to help you in any way. Okay.
All right, excellent. One more time. Thank you so much for that. And there is a follow up from Pamela. Okay, Pamela. So let's have a look. So I have had 2 file donation, frozen embryo transfers, and 1 successful but miscarriage at 9 weeks pregnant. So I guess,
Mm.
Pamela, your question is, so what would you suggest, yes, to do perhaps next? But if you would be able to add something as
Some
well,
information.
yeah.
I think that she asked about the dexamethasone because of this. Um,
Oh, okay, yes, sorry. There is a follow-up
no?
right here, so let me show you. So my successful one was with the dexamethasone, so probably that's the reason.
Um, but have you been studied by an immunologist, or did they give it to prescribe to you just because of the previous failure? Mm, the most important reason, the most important, yeah, the cause of miscarriage, especially with, I had a uterus biopsy. You have everything done, Pamela. I see. What that was normal. Uh, yes, because it was normal because you got pregnant. So the most common cause of miscarriage is a chromosomical abnormality in the embryo. Okay, nature is clever, and if the baby doesn't come properly or healthy, it stops. Stop it. So I see you have done all the tests for a failure implantation study. Um, I don't know if the question is, with all this history, shall I keep on taking dexamethasone or something like that? But my recommendation is that you go ahead with the treatment and try again. But because if you got it once, probably you're going to get it. Okay, so
Of course. Thank you so much once more for that advice. And actually, there is a thank you from Pamela right here as well. Excellent. Thank you so much. At least it seems that that was our last question. But of course, if anyone will have any more questions, you have the link, of course, which you can use, but also the email address that Dr. Yanira has provided. So, of course, if you have any questions and would like to get some more details, you can definitely get in touch with Dr. Yanira, and I'm sure she and her team will be more than happy to help you out with all of your questions. So thank you everyone for joining us tonight, for all the questions. It's been a pleasure to have you with us, as I've mentioned, Dr. Yanira, and thank you so much for your expertise and explaining everything. And well, is there anything you would like to add?
I think that I just want to thank you all for assisting to the webinar, to all those interesting questions. I hope I have helped you, and thank you to you, Caroline, for making this is very easy for me. And I don't think I have anything more to add. Just if you want to come to Spain, think about it, because you are going to be in a nice place for if you need the holidays, and you are going, or if you're not going to come for holidays, you are going to have a very excellent reproductive treatment. So anything you
Excellent.
need, I'm here.
Excellent. Thank you so much, Dr. Yanira. It's been a pleasure to host this with you. And well, I just simply hope we will be able to do it once again. And of course, there are more thank you. Yes, of course. So thank you. As you can see, very well answered. And can I ask whereabouts in Spain are you based? If you could
Well,
clarify.
where exactly? I'm in Canary Island, in Gran Canaria. Okay, I work in one of the EV clinics in Spain, which is in Canary Island, in Gran Canaria.
Exactly. So, definitely a nice place to be, to visit. So, thank you so
Yes,
much for that.
winter, in spring, in summer, all the
Exactly.
seasons.
Any time it's a good weather, always good weather there, right? Okay, thank you so much. It's okay. And of course, Amy, I just want to mention that it has been recorded, so don't worry. It will be uploaded on our website tomorrow, so you will have a chance to watch it from the very beginning. And of course, it will be available on myivfences.com. But of course, if you subscribe to our YouTube channel, you will be notified when the new video is uploaded. And of course, remember, we will be back today at 8 p.m. UK time, so very, very soon. And I hope you can join us because we will have another topic and, of course, another top experts. This time, we are going to have two doctors from Poland. So I just again hope you will be able to join us. And thank you so much, Dr. Yanira, once more for being with us tonight, for all the questions that you, of course, answered perfectly. And well, have a lovely and relaxing evening, everyone, as well. Thank you so much. Bye.
Thank you, Caroline.
Thank you.
Bye.
Take care. Bye.